Welcome to Unidontia Dental Podcast. Our today's guest is Dr. Shakti Singh Deora, who is head and neck cancer surgeon doing microvascular reconstruction surgeries, also running Asian Head and Neck Cancer Foundation. In this episode, we will learn about his journey of getting into the oncosurgery. What are the different types of fellowships that you can follow after oral surgery? A new concept called dental oncology, and how dental oncology will create new opportunities for dentists in the future, and a lot more with Dr. Shakti Singh Deora. Good evening, Shakti sir. Thank you for taking some time out of your busy schedule for our podcast. And first of all, I would like to tell you that you are one of the inspiration for me.
Thank you.
First, when I first met you, it was in Education for Cancer program in the launching event, and I was really motivated because I first time saw someone that is so passionate about talking about the cancer and cancer awareness, also doing amazing surgeries and having a super tight schedule, but still being humble and polite to everyone. So it's like really a really pleasure for me to have you on our podcast today.
Thank you.
So let's begin with the podcast. And first of all, if you can introduce yourself, what is Educane, what is Asian Head and Neck Cancer Institute, what is Northwest Cancer Hospital, a little bit about your career and about your achievement.
Okay, thank you, Rohan, for your kind appreciation and motivating words, even for me. So, basically, let me introduce myself. I'm Dr. Shakti Singh Deora, and I'm head neck cancer surgeon, presently practicing in Ahmedabad at Northwest Cancer Hospital. And I am also associated with an NGO by name Asian Head Neck Cancer Foundation. So, I did my master's in maxillofacial surgery. And after that, I have joined government medical college in Jodhpur. I was working as an assistant professor in Jodhpur. I worked for almost 3.5 years, and then I realized the importance of there's a lack of oral cancer surgeons in part of Gujarat and Rajasthan because the way the prevalence was increasing. At the same pace, the doctors was not getting trained. So I think that is where I have taken a decision to get training into head neck oncology. And thereafter, I went to Patna, there is Mahavir Cancer Sansthan. I got my training into head neck oncology, did my fellowship program there, and did my residency there. I was there in Patna for almost 3 years, and later I shifted to Ahmedabad. I'd worked with HCG Cancer Center, and then I'd worked with Narayana, Apollo, and all the hospitals, major hospitals of Ahmedabad. And after that, I established my own setup, that is Northwest Cancer Hospital. So that's my all professional journey all about.
And sir, can you share some incidents that inspire you to pursue head and neck oncology?
So for me to get into head neck oncology, I definitely would like to mention my mentor, Dr. S.V. Kumarswamy. Dr. S.V. Kumarswamy is one of the first head neck cancer surgeon who has been trained from maxillofacial background, and he trained into oncology. He headed the department of Kidwai Institute of Oncology in Bangalore, and he happens to be a mentor, my guide, my boss in my post graduation. His inspiration, his dedication towards cancer is the biggest motivation which I have got it. The second important point is, as I said, when I went into medical college, I used to see every day the advanced stage cancer patients, and unfortunately, there was a complete lack of awareness of these cancer patients. I mean, cancer in the general masses. At the same time, the people who are treating the cancers were also very less in number. If I tell you, in after 10 years in city like Jodhpur, still there are a handful of surgeons which are trained into head neck oncology. So there's a lack of or lacunae of the oral cancer surgeons, the way oral cancer is increasing in our part of the country.
And sir, you mentioned something about the dental oncology. So what is dental oncology? if you can brief out something about dental oncology.
Okay, so when we talk about dental oncology, so dental oncology is basically a specialized branch of dentistry which deals with the oral and dental care of the patients who are undergoing cancer treatment. Now, that cancer treatment, it can be the oral cancer, head neck cancer, or it can be general cancer treatment. This concept of dental oncology came from Sloan Kettering Cancer Center. So long back, around 8-9 years ago, when I visited Sloan Kettering Cancer Center, I could see they have a dedicated department of dental oncology. So Sloan Kettering Cancer Center is one of the world's biggest, largest, and well-known reputed cancer hospital across the globe. I've seen I've seen the Department of Dental Oncology, which was dedicatedly working towards oral health of these cancer patients. So I think my inspiration for dental oncology came from there. When I've seen in our country that dental oncology is not so developed, nobody is aware about what's dental oncology. It's not there even in the curriculum of the dentistry as what this dental oncology is. So we have taken the lead in developing the dental oncology concept in our country. So that's how in last year, in association with the Sloan Kettering Cancer Center, we as a foundation of as an Asian Head Neck Cancer Foundation organized the first international conference on dental oncology in association with the Sloan Kettering Cancer Center. And we have also planned to organize this conference every second yearly in our country. So next will be in 2024, and again that will be at the second international conference of dental oncology. I think that is the way we are going to spread the word of dental oncology across the country.
Definitely, sir. And I visited the first international conference, and it was such a good feeling, like learning from very well-known surgeons and all. And sir, you mentioned about earlier that you have done fellowship, and we have created a Google form and asked in so many groups where the people, just students, are taking admissions in MDS.
Right.
So they are want to pursue oral surgery, but there is one dilemma that everyone are talking about. After oral surgery, you have to do fellowship. So can you, what is your take on it, and what can you say about if a person is pursuing oral and maxillofacial surgery, then he or she should go for a fellowship, or it will be okay if there is MDS oral surgery?
Now it's a good question, Rohan. So I'll tell you what my boss used to say, that when you finish your MDS, that's masters in maxillofacial surgery, now you're fit to learn surgery. It's not that doing an MDS gives you a license to do anything and everything. I think that is the misconception what the new generation has. So what I want to convey to all the young, enthusiastic maxillofacial surgeons over there is, doing your maxillofacial surgery is just a license to learn maxillofacial surgery. Now, after your MDS is done, you have to take a path, whether you want to get into oncology, whether you want to get into aesthetic facial surgery, whether you want to get into the trauma, whether you want to get into the orthodontic, TMJ, cryptofacial. So there are various branches out there. So after that, you need to go and learn that specific work. And I tell you, oncology is something which is going to take your time, energy, money, everything. And if you do not have passion about cancer or oncology, I wish that you should not go and take up this field. You need to have a lot of patience, you need to have a lot of dedication, you need to have that hunger to learn. Then only you can get into the oral oncology. Because oral oncology is something which deals with the life of the patient. So yes, of course, you need to get trained. Your training might extend from 2 to 3 years, at least 2 to 3 years. So get yourself prepared mentally that if I need to get into oncology, I will give another 3 years after my master's is done to practice head neck oncology or oral oncology in the future.
Great. That's a big insight for everyone who listen. And sir, there is sometime when I read about the fellowships, some fellowship programs require that you have done some observership as well.
Right.
So can you tell me something about what is observership and how someone can get into it?
I tell you why we need observership is basically most of our the dental colleges which do not have a full-fledged department of oral oncology. So the orientation of oral oncology is lacking. We don't want people to come on a just out of fantasy that yes, I want to do oral oncology until unless they do not have a proper orientation that what cancer patient is there, how do they treat, what are the general care of the cancer patients. So that orientation need to be there. If after spending that three months or 6 months with the cancer patient, still if you feel that yes, I accept this challenge and would like to continue, then only you should get into oral oncology. So that 3 to 6 months of observership is needed to orient the students or orient the surgeons that whether they want to take up the oral oncology as their future or not. So that something which I feel it's mandatory to do an observership before you get into the oral oncology.
Definitely, sir. And so my next question is, sir, uh, can you tell something about you have done plenty of cases. You are like doing so much of diagnostic camps and all that. So can you tell some of your interesting cases that you have done in your PG life or in fellowship or in general in your career?
So Ron, what happens is for us in our practice, every patient is an interesting patient. Every patient is a new patient. Every patient comes with different pathology. Pathology means it's not about the histopathology, but the extent of disease, the extent of resection, the kind of reconstruction. Every patient differs. So for us, every patient is new and interesting patient. Because when I say be it a stage 1 patient or stage 4 patient, we need to treat that patient as a cancer patient. Irrespective of, we do not say that just because you have a stage 1 disease, small surgery, and stage 4 big surgery, there's nothing called small and big surgery. There's something called as the perfect surgery or adequate surgery is required for that particular disease. So what we have learned in over a period of time is that these patients who have been operated, we should do a good reconstruction. Because all these years, probably whosoever the surgical oncologists, ENT surgeons, or be it the maxillofacial surgeons, they were operating with an intent that patient should get the life. Patient should live without disease or cancer free. But now we have changed the orbit. Now what we say, what we'll advocate is a patient should have good quality of life. Now how do you give a good quality of life is doing a very good reconstruction. So yes, we have trained ourselves, we have given a lot of effort and developed the skill of microvascular surgery, that is microvascular free flap surgery, which is giving a very good quality of life. And being from the maxillofacial background, the kind of orientation we have, because if I talk about head neck region, I'm reading this head neck region almost since last 24 years. So I don't think that anyone can have that orientation of head neck more than me. So that is the added advantage being from the maxillofacial background, that how do we reconstruct. Along with that, we carry a big perception of how this patient can undergo dental rehabilitation also. It's not, we should not be just cutting and sending the patient. We need to think before you put an incision. It is very important that you understand that how this patient is going to live after my surgery, how this patient is going to get rehabilitated. That planning should come as a good surgeon before you put an incision. I think that is what we are working for, that before we start a patient, the rehabilitation should be completed in surgeon's mind. And that is what is lacking in today's world, being a cancer surgeon.
Definitely, sir.
and most of the time when I see in the colleges, like they have multiple departments. Oral surgery department is different from the prosthodontic and the rehabilitation department. So many a times it happens like the NDS is from the oral surgery department completed the patient, treat and cut down the oral whatever the tumor part is.
Right.
Then the prosthetic dentists come and then prosthodontics do their rehabilitation. So sometimes it happens in the college setups that the orientation to the rehabilitation afterwards, what the occlusion will give a patient and better life, the better quality of life is missing somewhere.
Yes, see, we from the dentistry background, we also have a lack of communication between our the prosthodontist colleagues or the other specialties of dentistry. So when we have a gap, think about the medical people. They have no orientation of what rehabilitation stands for. So I think that is where we should work together, shoulder with shoulder, with the surgical colleagues, and we also tell them that how a prosthodontist, how the periodontist, or how other specialties of dentistry can help them in giving a good quality of life, good dental rehabilitation, good oral and dental care to these patients who undergo cancer surgeries.
Definitely, sir. Sir, just as the mention when I first seen in the Educan program, can you say something about the Educan? What is Educan stands for and what Educan is doing right now?
So, education is something which is very close to my heart, and education for cancer. Now, why we started this program? This program was started to train our people, because before I tell anyone that do not make mistakes, I would like to train my people. I would like to tell my dental colleagues that do not make mistakes in diagnosis a patient. Most of these cancer patients who undergo or who go for dental checkup, who go with a dental pain to these dental clinics or dental professionals, at times their symptoms are being ignored. Because as I said, dental oncology is not very well established in any of the dental college. It is not there in the curriculum. So how do a dentist get an insight into what cancer is? How does it look like? What are the symptoms? What are the signs where he has to check it for? So what happens is we have I could see the lacunae in our dental professionals in diagnosis. So that is where the thought came to me that I should train our people first. And my boss used to say that we cannot become God to save stage 4 patients, because the literature fact is stage 4 5-year survival is less than 5%. But yes, if you diagnose this patient on stage 1 and stage 2, the 5-year survival is more than 80%. So how you can make a difference? We can make a difference only by early diagnosis of these patients. And I cannot go and screen 1,000 or 2,000 people. No, I cannot. So I need to create hands. So by education for cancer, we are empowering the dental professionals. We are training them. It's a 1 month course which is affiliated with the Gujarat University, and it's a 3 module followed by an exam, because we don't want just to enroll and get a certificate. We want actually that they should get trained into it. So we have 3 modules. The first module is on understanding of oral cancer. So what are the causes of oral cancer? How tobacco causes oral cancer? How you can play a role in tobacco cessation, habit breaking, and what are the clinical signs and symptoms of early cancers or precancerous lesions. Module 2 is all about the diagnosis. So diagnosis is basically, we have divided into the radiological and histopathological. So when you should get a radiology done, what kind of radiology you should get it done, what are the types of histopathology, how you can do the biopsy, and we empower our dental professional to do a true cut biopsy, which is a very small procedure to diagnose this patient. because at times what is happening is we people are becoming very overconfident, looking at the lesions. अरे यार आपको तो कैंसर है, आप चले जाओ कहीं और. And I think that is the worst thing which our dental colleagues are doing it. I request each and every one of you, please do not make this mistake of disclosing that you have a cancer without authenticated biopsy report. Third thing is about dental oncology. As I said, we are planning to spread the awareness of dental oncology in our country. So dental oncology is basically how a role of a dentist in maintaining the oral hygiene and dental health of these patients, which include the prosthetic rehabilitations, the extraoral prosthesis. So there are various kinds of how prosthodontics is involved, and now we are coming up with the dental implant supported prosthesis, which actually going to, again, as I said, enhance the quality of life. So these are the three modules we have. We train these people. These are online modules followed by an exam. Those who clears the exam, then this time in Educate 2.0, we have opened the avenue for workshops. So we are going to conduct the workshops at different centers across the country. So the first workshop we are organizing in Ahmedabad. That's on 26th of August, where we are going to teach you how to take biopsy, when you can do lasers, how you should do the lasers, fluid application, basic things which not only help you in generating a business, but also which helps the patients in maintaining their good oral hygiene also. So that is the whole concept of Educant we are spreading. And on this platform today, along with you, Rohan, I would like to request each and every one of you who are listening to our program that please do visit our website, Education for Cancer, and get information. If you have any queries, please get connected to us. One more important thing is now with the success of Educan in our country, and we have almost run the program for 2.5 years, we are expanding to other Asian countries. So now we are in a process to collaborate with the Bangladesh, when the same program will be conducted in the Bangladesh for the dental professionals, Bangladesh, Nepal, and Sri Lanka. In coming 6 months, we are going to start this Educant program in these three countries also.
That's awesome, sir. And I was just out of curiosity, I was like, if we went to a right path and do a Broadway awareness for the education program, and most of our dentists are able to learn about the cancer diagnosis pretty well. So, what will be the future of dental oncology in the coming years? How it can possibly change the face of India and the treatment part with I guess cancer is more prevalent in our country, and most of the time it's a head and neck cancer. So how it will be changed after once we as a dentist start diagnosing early on? So what will be your take?
Okay. So now there are two aspects I would like to draw your attention towards. So the first is, yes, I agree with the statement that India is the cancer capital of the world because of so much of abuse of tobacco. Our country has got the highest incidence of oral and neck cancers. Secondly, none of these cancer hospitals across the countries have a dedicated department of dental oncology. So the what future we are looking forward is we should start the dental oncology fellowships in our country. And we are again, as I say, we are in a process to start this fellowship program soon in association with the Sloan Kettering Cancer Center. We are in a talk with them. And once this fellowship program is being started, we are going to train our people and set into each and every cancer hospital of this country. So this is going to be a kind of a job creation for the dentist also. And yes, they need to focus on one field. You cannot be doing the dental oncology, general dentistry, implant this, that, no. You need to segregate yourself from the general dentistry and focus on dental oncology. And that is how the cancer hospital will appoint you as a dental oncologist and there will be a dedicated department of dental oncology in every cancer hospital. At present in this country, none of the hospital except few reputed hospitals like probably Tata or Amrita or few handful of hospitals which have got dedicated dental oncology units, but none of the hospital has. So you can think of the kind of job opportunities that can be generated in our country. There are thousands of cancer hospitals in our country, and thousands of dentists can play their role in Department of Dental Oncology in these hospitals. Secondly, we are training these people not only to join the cancer hospitals, but at the same time, if they are working in the rural areas. So how this educate program is helping is, now somebody is suppose practicing 200, 300 kilometers of Ahmedabad. So what we have the program, a interconnected program is, there's something called e-can clinics. So that is called early detection clinics. E stands for early detection of oral cancer. E stands for empowerment of dental professional. E for e-health services. Now, with the kind of digital era we all are going through, that even a patient is sitting 100 kilometers or 1000 kilometers, we can get connected to him. Look at the picture, look at the reports, we can talk to the patient, we can address his queries. So with that kind of digital generation we are into now, what we are doing is we are empowering the dental profession in the rural areas. We don't want people just for the screening to come to Ahmedabad and get the screening done. So we already completed the pilot project in part of Rajasthan, and we are soon going to start our eCan clinic project even in Gujarat also. So what this eCan clinic is going to do is, now whosoever is practicing or doing practice under eCan clinics, he will be doing general oral cancer screening, and we will be giving the whole support. In if they have a cancer patient, they can always connect it to us. If they have a patient been diagnosed, treated, again the follow-up should be taken by the same dentist. So we want the whole complete circle to be completed, and the epicenter should be the dental profession. And that is how we are helping in a two ways, that a patient doesn't have to travel every month to show to a surgical oncologist. It is a kind of waste of the human resources, energy, finances, lot of things. And secondly, if we go get his follow-up done from a dental professional, the kind of respect he's going to get into his people, his society, is something which will be recommended.
Definitely, sir. And sir, so we are ending our podcast, but before that, if you can give some advice to the current BDS students who are in the undergraduation program.
So, dear friends, I tell you, dentistry is the beautiful branch. And because I am from the background of dentistry, and I feel this dentistry is something which make you an entrepreneur. Right from the day one you start your clinic, you're independent. See, there's something which you are not dependent on any corporate hospital, that somebody will hire you. No, you don't want to get hired. You, from day one, you become an entrepreneur. You start a clinic from the scratch and you take it to a higher level. You open two more clinics. You start working on you develop your skills. You give the quality of life to these patients, and at the same time, you have a very comfortable life. So I think this is what I feel about dentistry is, you get good time for your family, you get good time for your friends, you are not dependent on anyone, you are an entrepreneur, you can go from 0 to 100, it depends on your ideas, your mindset, your support, everything depends on yourself. Nobody's, unlike in medical professional, you are not dependent on any, again I say, any of the corporate hospitals that they are going to support. So I think this is very important thing which a dentist should understand, that do not compare yourself with anyone. Your field, take it as you are in one of the beautiful field of medical sciences, which gives you good time for family, money, which gives you respect. So everything you get in an equal amount. So do not compare yourself with anyone. Secondly, I tell you, very important thing is, everyone says that we don't save lives or feels that यार हम क्या करते हैं, हम कोई emergency में किसी की जान नहीं बचाते हैं. But I tell you, friends, if you diagnose one patient of cancer, that is equivalent to your saved life. So you play a very, very important role in saving a patient's lives also. So I think my message is very loud and clear. Stick to your field of dentistry. Be faithful to your patients and do not compare yourself. Be consistent, work hard, and do your best.
Definitely, sir. It will be whenever I hear you, it will be such a motivating and inspiring speech. And also, sir, if you can give some advice to a current who just passed out MDS oral surgeons.
So, as I said, Rohan ki, everyone in the field, they feel that we have just completed our MDS, now I can operate anything. But no, that should not happen. I remind you again, just completing your MDS exam is something that now you are fit to learn maxillofacial surgery. So you need to sit, you need to work with your mentor, you need to select your mentor in which field now you want to go. You cannot do orthodontic, implants, oncology all together. Do not do all kind of the khichdi kind of work in your profession. Be clear in your mindset. If you want to become a oral oncology or head neck cancer surgeon, stick on to that. Give time, have patience, and work in that direction. Do not change your field. Do not look for money for some more time. Do not look for the short gains, but look for the long term gains. And I can assure you, if you give your time, your dedication, your passion, I can assure you that after 5 years, you will be totally in a different orbit. I say orbit, not levels, because we all work in a different orbits. So do not work like, you can do each and everything. So what we say, the jack of all but master of none. But I am in a philosophy that you should master one, work for that mastery which you have developed, because ultimately that is going to help your patients. So that is my message to each and everyone who have just completed the masters.
Definitely, sir. And sir, just last question before we end the podcast. As you have diagnosed so many patients, you have interacted with so many patients as well. So some myths will be very prominent among those patients who are having cancers. Can you share some of those myths and how the facts are and how we can approach a patient to convince them?
Okay, so very important, the first myth, दांत निकाला कैंसर हो गया. And that was the one line which inspired me to start this education program. See, this I am listening since last 20 years when I was doing my undergraduation. कि दांत निकालने से कैंसर होता है. And still after 20 years, I could hear the same. Why? Because somewhere we people are not, we means our colleagues are not competent enough to diagnose the patient. See, suppose a patient comes with a mobile tooth, he'll be very happy to extract that tooth because it's a mobile tooth. मजा आता है निकालने में. You don't see what is there down. So somewhere the saying is, your eyes cannot read what your mind doesn't know. So you ignore the symptom of a cancer and you just pluck out the tooth. And when healing doesn't happen, patient comes after 20 days, you say, yaar, ye to aapko kuch problem hai. Now you go and meet another surgeon, onco-surgeon. So I think that is one thing which is very important, that we all need to learn the basics of oral cancer in diagnosis. We should not misdiagnose any patient. We should not ignore any symptom of cancer when a patient visits to a dentist. So Yes, this is a myth that दांत निकालने से कैंसर होता है. I agree. It's a myth. But at the same time, this is also a fact that our dentists, our dental colleagues should get their adequate training into head neck cancers. The second is, as I said, do not declare the diagnosis of cancer just looking at the patient's mouth without any biopsy report. You just say कि यार आपको तो कैंसर है, आप सिविल हॉस्पिटल चले जाओ. It should not happen. That is ethically, professionally, it is not right. You need to examine the patient, talk to your maxillofacial surgeon, talk to head neck cancer surgeons that I have this patient. What should I do? If you are empowered enough, do a biopsy, do the diagnosis, ask the relative, talk to them about the surgical planning, or I can say the further treatment planning, and send the patient to the concerned authorities and take the follow-up when the patient is back. So there are two aspects which I feel I feel we as a dental profession should break these two myths and come out of this. So these are very two important things which I wanted to address.
Thank you so much, sir, and thank you so much for taking your time out to have such a great conversation. It will be I hope it will bring some value to whoever is listening. And thank you so much again to help to be a guest on our podcast.
Thank you, Rohan. Thank you for inviting me, and I wish you good luck to each and every one of you. Thank you.
Thank you.
Thank you for watching till the end. Hope you have got some value from this episode. We have placed all the necessary links in the description. And if you want your questions to be asked in our upcoming podcast, there is a form in the description and on our website. So do check it out and give us a like and subscribe to our channel to support our work. Thank you so much.